Let's talk about the 5 most common myths about the vasectomy procedure. So myth number 1 is that the vasectomy has a risk of causing sexual dysfunction. And that one is absolutely false. There's no risk that a vasectomy will cause any issues with erectile dysfunction, issues with orgasm, ejaculation, sensation. Everything will look and feel the same. The ejaculation, the same fluid will come out, and unless you have a microscope, you'd have no way of knowing if somebody had a vasectomy or not. The nerves that control the sensation and erection are nowhere near where we're working for a vasectomy procedure. So the risk of a vasectomy causing any sort of sexual dysfunction is essentially 0. The second myth has to do with testosterone, that a vasectomy will somehow cause you to have lower testosterone, and that's also absolutely false. The vasectomy procedure, we're not working anywhere with the blood supply of the testicle on either side, and vasectomy procedures have been done for decades, and if they were causing men to have low testosterone, we clearly know that by now, and there's been no association even suggested in the scientific literature, so that risk is also essentially 0. The second risk, or the third myth, is that the decision to get a vasectomy procedure is not that big of a deal, because if you change your mind later, you can just get a reversal. And that one, while technically true, I'm still going to count it as false, because a vasectomy reversal is, 1, not covered by insurance, so you're looking at about $10,000 out of pocket, and it doesn't always work, right? Especially if you count a success as having a live birth. A lot of people who have a vasectomy reversal never go on to have a live birth. Now, obviously, there's a female factor associated with that outcome, but obviously that's the outcome of interest. So you're putting yourself in a situation where you're paying $10,000 out of pocket to do a procedure that may or may not work. So we tell people, unless you're 100% sure that you're never going to want to have a reversal, you shouldn't get a vasectomy. You know, life changes, all of a sudden you have a lot more money or a newer relationship. You should be 100% sure before you go in to get the vasectomy, and not just go into it with the idea that, oh, if I change my mind, I'll get a reversal. The fourth myth is the myth that vasectomy is extremely painful, and it's torture to do it in the office awake. I do over 90% of them in the office awake, and people describe it as 20 minutes or so of discomfort, but nobody's screaming in pain. Before we do the vasectomy, when we do the consultation, we do an exam in the office, and if we get the sense that the patient is going to have a lot of pain or anxiety related to the procedure, or based on their body habitus or their anatomy, that this is better to be done under anesthesia, that's not a big deal. We can get that approved by insurance to do it in a surgery center under some type of sedation or even complete general anesthesia if we need to. So the pain should not really be a factor when making the decision. If you're somebody that has a low pain tolerance or just a lot of anxiety about pain, we can do it under anesthesia, and it's not a big deal. But for over 90% of men, it's not a big deal to do it in the office. It's just 20 minutes of discomfort. So that one I'll also consider to be a false myth, that the vasectomy is this extremely painful experience. And then the fifth myth, which is probably the most important, is the idea that a vasectomy might increase your risk of some type of cancer, whether that's testicular cancer or prostate cancer, and that's also been completely debunked. Again, vasectomies have been done for decades around the world, and thousands, if not millions, of men, and there's been no association between getting a vasectomy and any increased risk of cancer. Obviously, if there was, we would not be doing them. So that myth is also false. So those are the 5 most common myths that patient asks me about vasectomies, but if you have any more, I'd love to hear them.